Okay, so the idea now is to talk about malignant otitis externa. And when we are talking about malignant otitis externa, we are talking about otitis externa, but that has been complicated. Usually, it is caused by Pseudomonas aeruginosa. It can also be with methicillin-resistant staph aureus. They cause osteomyelitis, which is infection of the bone of the temporal bone. Then there is an osteomyelitis of the temporal bone. Now, uh, what can be seen in this devastating situation is again that those patients are usually immunocompromised and with diabetes, for example, which is very important for developing it. Usually, it's not happening in healthy individuals. Now, it can spread and can involve cranial nerves, CN. For example, CN7, which is the facial nerve. Not only, but also more deep cranial nerves like the 9, 10, and 11 cranial nerves. This osteomyelitis, this infection can spread and involve cranial nerves. Now, when we are talking about diagnosis of malignant otitis externa, we use imaging, which usually use CT scan of the temporal bone. There the infection starts. We are taking cultures to identify the organism, which is usually Pseudomonas aeruginosa or MRSA, and we're taking biopsy to differentiate it from a malignant process of, for example, cancer. So when we're talking about CT, we are talking about high resolution CT using in the temporal bone. It can show increased radiodensity of the mastoid hair cells. It's in the temporal bone. Sometimes can uh, sometimes exposed bone can be seen when checking the patient in the ear canal. Cultures are done to identify the causative agents, and again, biopsy is done to differentiate it from malignancy. For example, squamous cell carcinoma. Now, when we're talking about treatment of this process, when we are talking about treatment of this process, we're talking about one, antibiotics, typically fluoroquinolones. Remember that fluoroquinolones can penetrate joints or and if you want, aminoglycosides with penicillin or semi-synthetic penicillin. Those are the systemic antibiotics. Now the second option, or we use also topical antibiotics with steroids like fluoroquinolones with steroids drops in the ear, and rarely surgical treatment is needed. Now these patients have secretions and the ear looks very bad. If we're looking for malignant otitis externa, we will see a very bad looking ear, red ear. You can see here the CT, but you can see here that the ear is very red, erythematus. It has secretion in it, and it doesn't look good. It looks bad. So that the treatment can be taken off uh, politely. Drops can be given to the ear, and systemic antibiotics are used. culture is done, biopsy is taken, and the imaging is used to identify the spread and the infection on and where it goes. You can see here the options. So this is a very, very severe disease. Usually the antibiotics is for 6 weeks IV antibiotics. Otherwise, for healthy, very mild disease, also can be used for shorter duration and PO, but more severe disease should be used with IV antibiotics. And this is it about malignant otitis externa, which is caused by Pseudomonas, MRSA, usually in immunocompromised and diabetic patients. And if we're talking about diabetic patient, one of the important part of treatment is balancing the diabetes. We need to balance those patients. And if there is immunocompromised, we need to somehow treat the immunocompromised patient, immunosuppression. Now, not always it can be done. For example, patient who gets immunosuppression for the disease, for I don't know, rheumatic disease or for cancer or for I don't know what, something that need to be used for immunosuppression. So we don't always can, but if we can somehow make the patient less immunosuppressed, it can also help. It can involve the cranial nerve, so we need to check for cranial nerve involvement. And that's it. And if there is any cancer identified in the biopsy, it should be treated. So this is about malignant otitis externa. Thank you very much. If there are any mistakes or correction, please tell me. Thank you very much. And that's it.